Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us. For Your Health is exactly what it sounds like. It's a program that basically helps you to stay informed and stay healthy. Well, delivering all that health information today will not be me. It will be Caitlin Pico. She is a public health nurse coordinator for the Quincy Health Department. Caitlin, welcome back.
Thank you for having me.
Great to have you. And as always, we do want to thank the access centers throughout the country. I didn't mean county, I mean country, because they pick up this program and air it on their stations as well. We thank them for, I suppose, showing interest.
Yes, it's great to get the word out there and get this information to as many people as possible.
The topic today is one that everyone could benefit from, including me. It's seasonal allergies.
Yes, and we're right in the midst of it. It just began. So I just thought it was a very important topic just to cover, just because it can be so similar to other things like to COVID and all of that. So just run through the basics just to people know what to monitor for and when to reach out to a doctor.
And people really can have allergies all year round. I mean, there's people that are allergic to dust and not only pollen. So people might be dealing with this, might be fighting this off the entire year.
Yes, and that can happen. It depends on, of course, what you're allergic to.
And the country and the region of the country that you live in, too.
Yes, allergy seasons are different depending on where you live, depending on the climate there. So it's very important to know and to know what symptoms to monitor for and how to act and who to reach out to if you do experience symptoms.
Very good. I think we should start with an outline. Sound like a good idea? Okay. So the outline, what are seasonal allergies? Who gets allergies? Common signs and symptoms. How are seasonal allergies diagnosed? The treatment and tips to ease allergy symptoms. Because a lot of it does come down to that. Allergies pretty much is something you live with, and you basically try to lessen the impact on your health.
Yes, and especially anybody knows if you step outside during allergy season, it's tough to avoid completely all allergens. So it's really just learning how to deal with it and how to best manage your own symptoms.
Okay, so what are seasonal allergies?
Yeah, so seasonal allergies, it can also be described as hay fever or allergic rhinitis. So these are symptoms that occur during a certain time of the year. And this is typically when trees, grass, and weeds are releasing pollen into the air to circulate and fertilize surrounding plants.
We should mention that if folks notice a kind of a light coating of green on their cars, on maybe their chairs, on their outside porches, that's the pollen.
Yeah, so it can be very visible, and there are also times that you can't see it in the air as well. So it's hard to avoid anytime you step outdoors. But basically, what happens is when somebody is allergic to these particles in the air, your body reacts by releasing a chemical because it's a foreign body entering your system. So although the pollen particles are not themselves harmful, some people can have their body releases chemicals or histamines into the bloodstream to defend against this pollen, and that is where you see the symptoms of
so it's
allergies.
Like an outside invader.
Yeah, so your body treats it as an invader, and that's where you get all those symptoms from. And as we said, depending on your climate, depending on where you live, right now in New England, like we are in the beginning of our season, and it all kind of depends because for tree pollen, you may find your allergies are worse from March to June. For grass pollen, we would have from early June throughout the summer. Pollen from weeds you would typically see late summer, early fall. And then also mold spores. That would be most often like spring, summer, and fall. But depending where you live, if you live in a apartment or a home that has a lot of moisture in it, if you were to have mold, you could have those allergies again year round. So you want to just make sure you're staying vigilant, especially if it were to be mold. You want to make sure that you call your local health department to make sure that it's being evaluated and you're treating it appropriately.
Because mold can make you very sick.
It can make you very sick, yeah. So if you suspect it, like working in the health department, we do have a lot of calls, and we can follow up. And then there is also the CDC does release a lot of information on how to appropriately clean to get rid of mold. So they're great. The local Board of Health, wherever you may live, is a good resource if you believe there is mold within your home.
And when you spoke about tree pollen, especially from birches, oaks, elms, and maples.
Yeah, so that is kind of a lot of people are more allergic to that rather than others. But again, it all depends on your own body. It's very individualized.
Who gets allergic?
Yeah, so
A lot of people, I would imagine.
yeah, so a large amount of the population does deal with seasonal allergies. Anybody can develop allergies, of course. Typically, we would see a diagnosis after the age of 2 years old, and typically before somebody turns 20 years old. But again, you may have a 1-year-old that's experiencing allergies. It's also interesting to know that you can have allergies, they can disappear, and then they can reappear years later. So it's not clear-cut, although a lot of things in medical are not clear-cut, of course. But there is a hereditary link associated. So if your parents had allergies and your siblings have allergies, there's a high likely chance that you yourself will also have those allergies.
I think, I'm glad you said something that I can relate to a lot of what you said so far, but especially the time frame. When I was younger, lilac, when I was in grade school, lilac was something I was allergic to, but now I'm not.
Yes.
So that lasted for a little while. It's gone away, but it sounds like it could potentially come back.
It can, yeah. So it's very interesting and it's very individualized. So it's a tough thing to tackle, but you'll have to keep in touch to see if does that reappear in your lifetime.
Something to look forward to.
Yes.
Not at all. Let's talk about common signs. Don't do that to me. Common signs and symptoms.
Yes, so usually seasonal allergy symptoms come on suddenly, and it lasts for as long as you are exposed to that allergen, of course. And these can sometimes start as cold-like symptoms. So individuals can experience sneezing, itchy nose or throat, nasal congestion, or a clear runny nose. So that would be the opposite of that congestion. You might experience postnasal drip. In allergic conjunctivitis, which just would be itchy, watery, or red eyes, very irritated eyes. And a lot of people that do have seasonal allergies may have an additional diagnosis of asthma. So in that case, when somebody that has asthma is exposed to pollen, for say, if they're allergic to it, it can also trigger wheezing, coughing, or shortness of breath. So very important if you do have asthma. Make sure you're staying in contact with your doctor. I know that's my favorite thing to say on this show, but you want to make sure, because that can be life-threatening if you do become short of breath due to allergies. And some other major complications besides respiratory that you might experience with these symptoms would be sinus and ear infections. And you want to think of that because of the swelling of the nasal membrane, it's not allowing the fluid to drain. So you may see a lot of co-infections like ear infections and sinus infections when you do experience your seasonal allergies.
I know that I've been told by my physician that I do have sinusitis. So something like an allergy could, I suppose, worsen that condition.
Yes, so it can trigger it because then your body's reacting, and your body, if it's making the constriction worse, you're not having the proper drainage. So it's very, again, it's very individualized, but you want to make sure, especially when we get into treatment, you want to make sure you're just following the proper thing for yourself because your body may react a little bit differently.
And on that note, before we continue with diagnosis, and I suppose part of diagnosis actually would be careful when you use the computer to kind of figure out what you're experiencing. I think we both agree that it's okay to do that, but you should also involve your physician.
Yes, anytime, because so many times, no matter the health topic, I feel like we're always saying cold-like symptoms. So it's very hard to determine what is causing that for the individual. So you can Google your symptoms and you might find 50 different conditions you may have. So it's very important to collaborate with your primary care doctor. And in this scenario, if it were to be allergies, they may refer you to an allergist who specializes. In that way, they can kind of rule out to make sure it is nothing else. Because even right now, we're still dealing with COVID-19. And a lot of these symptoms you also see if you were to have COVID. So it's important to keep in contact. I know people know their own body, but if it's new symptoms or changing symptoms, make sure your doctor's aware just to kind of keep an eye.
I'm glad that you had mentioned COVID-19 because that now is in the mix as well.
Yes.
Let's talk about diagnosis and how does one find out what he or she is allergic to?
Yes, so if you yourself or a child is experiencing allergy-like symptoms, we always say, again, refer to your primary care doctor. And as I just said, they may recommend you follow up with an allergist. And these are physicians that are specialized and trained to do testing to determine what that individual may be allergic to. So there are two main types of testing. So we have skin testing and we also have blood work that can be done. The skin testing is the gold standard. It's more cost effective and the results are almost instant in some cases, or very quick to respond at least. And as I said, with these allergists, you want to make sure you're going to a trained professional because whenever you're, in this instance, you're testing for allergies, you could have an adverse reaction or an anaphylactic reaction. So you could go into respiratory distress. So you want to make sure you're with a trained professional because they know how to counteract any symptom, and they can help you if it were to become life-threatening. And also, they are trained to interpret the results. So what we would look at, so for the skin test, there's two different types. The first one is like a prick test or a scratch test, it may be called. And basically in this technique, it's the most common. They take a teeny drop of the possible allergen. So say it's pollen from a tree, pollen from grass, pollen from weeds, even dust. You had mentioned dust earlier. So they would scratch it against the skin and then they would monitor that area for a reaction. And again, this is minimally invasive and it provides very quick results. They also have an intradermal test. So this is when a small amount of that allergen is actually injected right under your skin. It doesn't go very deep and the needle is tiny. But this intradermal test may be performed if a prick test comes back negative or is non-reactive. They might try the intradermal test just to find out a little bit more about that allergen. That just can, if there were to be a reaction, it might just show a little bit better than the scratch test. And then also for the blood testing, this would be ordered to determine a specific allergen, of course, but it's less cost effective. Results take longer, and there can also be false positives with the blood work. So that's why they always try to go with the skin testing first. And just some complications that can come with the skin testing. The most common are localized itching or redness at the site. But in rare occasions, as I mentioned before, a reaction can become life-threatening, and that's why you want to make sure you are with a trained professional that knows how to countermeasure whatever reaction you might have.
And you could be allergic to multiple things too. It might not be just one allergen.
Yes, so and it's very important before any of this testing is done, the provider will work with you to get your medical history, to determine what medications you might be on, what symptoms you're having, to determine what are the appropriate allergens to test on you. Because if they think you might be severely allergic, they would be less likely to try that one. Because they're trying to figure out what you're allergic to so they can help give you the best treatment to countermeasure it, but they don't want to put you in harm's way by any means.
As you had mentioned, we are recording this program in spring, in the month of May, but honestly, again, some of these allergies can be suffered by folks year-round, depending on where they live and depending on what it is.
Yes. So definitely just stay in contact. I know I always tell people stay in contact with your doctors. I know doctors' offices can be very busy, but even just call, and if you can talk to a nurse just to give the information. A lot of this is managed over the counter, and if that is working for you, that's great, but just make sure there are no interactions with other medications you're on. Another good resource for that would be a pharmacist. Your local pharmacist where you're picking up your medications, they would be able to look at the medications you're prescribed to determine if there would be any counter interactions.
Over the counter, I'm glad you mentioned that. I knew we were getting there. But there are countless medicines out there, over-the-counter medicines, and possibly prescription as well.
Yes.
To deal with allergies.
Yes. So this is a good segue into the next section for treatment.
I knew that.
Yeah. So for the over-the-counter treatment, of course, so the main one that we see a lot are antihistamines. When I first mentioned, your body, when it is fighting against this pollen or this whatever your allergen might be, your body is releasing histamines into your blood to counteract it. Antihistamines work to block that receptor. So when you are exposed to it, your body, you're not going to get that congestion. You're not going to get that sore throat because it's going to block the histamines from being produced. It's important to know with some of these though, some antihistamines do have a sedative side effect. So you want to make sure you know what you're taking. If say for example Benadryl, you might not want to take that before your work day because you might be falling asleep an hour into it.
Might be a problem getting to work if you have to drive.
Yes, that as well. So you want to just make sure you know what you're taking and it is safe to operate your daily life while taking it. And it's also, these antihistamines vary in potency as well. So there's many brands on the market. For example, Allegra, Zyrtec, Claritin, some of the main ones, and again that Benadryl. So you just want to make sure if one doesn't work for you, there might be another one on the market. But definitely test it out. And again, work with your doctor or your pharmacist just to make sure there are no counter interactions. And in collaboration with the antihistamines, we do see a lot of decongestants out there on the market. But these decongestants, they can have a side effect, like a stimulant side effect that can make you feel shaky, maybe make your heart rate fast. So you just want to be a little careful with taking these with your own medical history. Take that into account. There's many nasal sprays, of course. One important thing for the nasal sprays, they can cause vasoconstriction, so that can worsen your congestion.
I was going to say that doesn't sound good.
Yeah, so with long-term use, you might have that vasoconstriction. So you, again, if you feel like you're taking this for extended periods of time, make sure, just check in with your doctor just to make sure it's safe for yourself. We also see inhalers, especially for individuals with asthma. If their allergens are triggering their asthma symptoms, they may have different inhalers to help with their breathing. And also eye drops, because if you do have that conjunctivitis, eye drops can help soothe with the redness, the itchiness in your eyes.
We should mention, talking about the eyes, that the way for germs to get into your body, one of those ways is through the eye. So if you're rubbing your eyes a lot, you're actually potentially exposing yourself to germs.
Yes. One thing I feel a lot of us probably learned in COVID, how often we touch our face with unwashed hands.
That's me right now. Well, these are washed, but yeah, constantly.
Well, you're in the supermarket and you scratch your eye. Like, you don't think of it too much, but you need to keep in mind how many germs are on your hands. And again, portals of entry, your eyes, your mouth, your nose, germs can go in. So you want to make sure, wash your hands and stay safe. But that's always very important. I feel like COVID probably brought that up for a lot of people. You realize just how dirty your hands may be.
I think so. I think so. Let's talk about tips to ease allergy symptoms.
Yes, so again, when we're talking about seasonal allergies, it's very hard to fully avoid it. We have to go about living our lives. You have to go outdoors.
You want to smell the roses, I would imagine, right?
So you want to make sure, one important thing, stay tuned to your local weather forecast and stay indoors as much as possible during peak pollen counts. With your local weather, they may mention that on the news in the morning report. You would also want to schedule your outdoor activities for later in the afternoon rather than the morning. One important one is close your windows during these high peak pollen days. Of course, in my home, anytime it's above 70, I want to open every single window.
Me too.
Keep in mind, the pollen can blow right in. So there are, even if you had an air conditioner with like air vents on it, air filters, that could be useful as well.
Because we should mention that pollen is very, very, very fine.
Yes. So it's very hard to, the only way you can really see it is if, again, it is lining on your car or your surfaces around your home. Another thing you could do, I know we're probably all sick, some of us are sick of the face masks.
All of us are.
But if you were to have to work outdoors, you can wear a face mask and either glasses or something to shield your eyes from the pollen. You want to keep your grass cut short and avoid gardening chores that may stir up your allergens. So maybe if you are very allergic, maybe if you can maybe afford someone to cut your lawn. I know in my neighborhood there's a lot of young kids that would do it for $20, which is nice. And then just common sense, when you do come in from outdoors, wash your hands. Maybe if you were outside for an extended period of time, you could shower to wash it out of your hair and your clothing. And one thing people don't think about is your pets as well. If you're bringing them in from a long walk, maybe brush them down, or if you have if it's a dog, for example, if you have dog wipes, you can wipe the top of their fur, just to kind of reduce the amount of pollen from entering your home.
Very good. And they may suffer too.
Yes, so not as, it might be a little harder to see their allergies, but I'm sure I would consult with your vet because I'm sure that is out there. Dogs and cats, there's a lot of different health conditions you wouldn't think they could get.
Right,
So.
right. Well, I want to thank you for coming in and certainly sharing this topic with not only the folks in Quincy, but well beyond.
Yes, thank you so much for having me. As always, it's been a pleasure.
You're welcome, and have a great seasonal allergy season, I
Yes,
guess.
yes.
Stay allergy-free, or
Yes.
as much as you possibly
As
can.
much as you can.
And thank you at home for watching, and just please remember to support the local access TV station in the town, the city in which you reside. Take care.